The standard narrative about the opioid crisis is one you probably know well. In many cases, patients got hooked on prescription pills and usage escalated toward heroin and synthetic killers like fentanyl. But there isn't just one path to addiction in this crisis. Mixtures of opioids with drugs like cocaine and a spike in deaths, especially among African Americans, have officials worried the crisis could get much worse. For more, we welcome in IdeaStream's Tony Ganser, the host of All Things Considered on 90.3 WCPN. Tony, welcome back to Ideas.
Hi, Rick.
A lot of work you've put into this. Your reporting looked at cocaine in particular, though, in the opioid crisis.
That's right. And this is really an evolution of the opioid crisis because, as you said, we have this idea that the crisis started with legal painkillers and maybe people got addicted to those, and once that didn't fulfill their need, they moved on to something like heroin. But what we've been seeing is synthetic opioids, like you mentioned fentanyl, or an even more powerful one called carfentanil, which is a large animal tranquilizer. These things are finding their way into illicit drugs. So we're seeing mixtures of fentanyl plus meth, fentanyl plus heroin, or fentanyl plus cocaine. And this is such a big problem with these mixtures that the U.S. Attorney for the Northern District of Ohio, Justin Herdman, he actually says he doesn't talk about an opioid crisis anymore.
It's actually such a problem that I've stopped talking about there being an opioid crisis, and I speak more generally about there being a narcotics overdose crisis. Because of the numbers that we've seen with our death rates driven by substances like cocaine and cocaine alone, it really has reached the level where I think it's inauthentic to talk about just opioids. We have to address all the narcotics that are on our streets, and that clearly includes cocaine.
That is frightening to hear. You talk about deaths. There have to be some numbers that show us just how much of an escalation we're talking.
That's right. The U.S. Attorney emphasized that fentanyl is what is driving up these death rates. And the Cuyahoga County Medical Examiner's Office has really been at the forefront of identifying fentanyl mixed in with all these drugs we're talking about. And I think we have a chart to show just how many deaths we're talking about. So in 2013 in Cuyahoga County, we saw 2 deaths with cocaine and fentanyl, 2 with heroin and fentanyl, and 5 with just fentanyl. In 2017, 200 deaths from cocaine and fentanyl, 205 with the heroin mix, 477 involving fentanyl. And provisional numbers for this year already are showing that the cocaine mixture has actually surpassed the heroin mixture. And fentanyl's involved in all of this, and some things called analogs, which are derivations of fentanyl, just different mixtures, So the medical examiner's office has a toxicology lab, it has a drug chemistry lab, and they're talking to each other, and they're saying, we're finding this evidence out in the field, we're analyzing it, we're seeing that all of these different synthetic opioids are popping up, and it really is adding to the fatality of this crisis.
Big part of your story is talking about how this is impacting and being treated in the African American community. What makes it different?
When you look at fentanyl-related deaths among African Americans, in 2016, 58 people died. In 2017, 99 people died. And there is this tendency to say, well, that's a drop in the bucket when you look at the overall hundreds of people dying. But what this says to the officials is that this is a trend. We're seeing an uptick in deaths among especially older African American males. And what you're seeing is longtime cocaine addicts, for example, they're being introduced to fentanyl without their knowledge. So dealers are lacing this stuff. They're not telling the people who are using the drugs, and the death rates are increasing. And because some of these communities are so vulnerable, they don't have as well access to social services, they're dealing with other problems like extreme poverty. This is an incredibly vulnerable population. So anything can tip the balance from a crisis we know about to something much, much worse.
Yeah, you talked to a person by the name of Jessica Horne who helps explain some of what's going on?
That's right. And one of the things she told me, which I thought was really interesting, is she said she was trying to get the word out that this is a problem in the African American community as well. But she said people weren't having it.
If you look at the media, the new face of addiction is white. We took a flyer out that said the signs are everywhere. And there was a guy standing on the corner and was handing him the flyer. He said, "What you giving it to me? That ain't none of our problem." And I was like, wow.
Yeah, wow is right. That's cocaine. What about fentanyl in the African American community?
So the fentanyl being mixed in with the cocaine, it's this mixture actually, and you may ask yourself, why is this happening? Why would a dealer do this? Because fentanyl is more fatal to the addict. So
Dealer's killing his own patients.
That's
or
right.
His own,
Customers.
buyers, right.
That's right. So you're saying this isn't a smart business strategy if you would expect that from a dealer. But what's happening is fentanyl is so addictive that they're hoping it proves to other people who aren't addicted yet. They say, wow, that's some really good stuff. I'm going to take that. And all this is doing is adding to the number of people who are dying.
We talked about the racial aspect before. Is this being compared to the crack epidemic and how we're looking at it differently in certain areas?
There is some comparison here, but some people are saying not clearly enough. And Jessica Horne told me repeatedly she didn't want to get into the race issue because too many people are dying. She didn't want to have that conversation. But she did say comparing the opioid crisis as a quote-unquote white problem and the crack epidemic as a quote-unquote black problem. She made this comparison.
And so I'm going to say that the lessons that we learn are the reasons now that we're not using this as a criminal piece, that we're not, that we're having compassion, that we're trying to get people to treatment and those kinds of things.
So something I asked Horne, I said, what's it going to take before we start talking about this as a people problem? Why are people not just addressing this as a public health crisis for our entire community? And what she said is we have to admit that we have a drug problem in this country. If fentanyl is dealt with tomorrow, it's going to be some other drug. So what she wants to see, especially for young people, is more investment in dealing with all of these externalities, which are adding to stress and adding to the situation where they think drugs are an escape. And one thing she told me very powerful, that you may look at a house from the outside and it looks fine, and
Sure.
we're the house. But inside, a fire could be raging. Stress is just devouring that place, and we need to learn to live in the fire without burning up.
Good reporting, you and the entire team. Tony Ganser, thanks so much.
Thanks, Rick.